So, hi friends, this is Sridevi, Nursing Officer at AIMS Mangalagiri. So, finally I am back with our classes for NORCET, for upcoming vacancies. So, not only for NORCET, for all exams going in nursing field. So, before going into our video, if you think this is useful video, please don't forget to like, share and subscribe to our channel. So, first question is, in the post-anesthesia care unit, is reported that a client received intrathecal morphine intraoperatively to control pain. Considering the administering medication, what should the nurse include as a part of client initial 24 hours post-operative care? So here actually one patient is there. For that patient, he undergone surgery. In between operation, they have given morphine injection intrathecally to reduce pain. So in that situation, patient is in a post-operative management. In that how nurse will plan for within first 24 hours to see the contraindications or to observe the medication effects. So here we'll see first main thing is morphine. Drug we need to focus first. Morphine, it went intrathecally and we need to observe 24 hours period post-operative. So, first we will see morphine. Before that, we need to see the options also. Option A, assessing a client for tachycardia. Option B, monitoring respiratory rate hourly. Option C, administering naloxone every 3 to 4 hours. Option D, observing the client for a signs of CNS excitement. So first we will see morphine. What is morphine? Morphine is a opioid drug. Opioid drug. Opioid drug. So opioid drug, under opioid drugs, what and all comes? We will see today. First, morphine. Morphine is a morphine discovered from papaver somniferum, or simply we will call it as a pappy plant. Pappy plant. So this is morphine derivation. Next, under opioids, what and all comes? First is morphine. Morphine, mostly used drug in opioids. Mostly used drug in opioids. This is morphine is used for painkillers. It will used for pain relief. Painkiller. Morphine is used for painkiller, means to subside pain of the patient. Next, second one is heroin. Heroin. Heroin is a most potent drug in opioid. Most potent drug in opioids. So, this will work. Heroin is the very strongest medication in the opioid. So, heroin will work 100 times more than the morphine. 100 times more than the morphine. So, that's why heroin mostly we won't use because it will affect more than morphine. So, we used to use morphine as a painkiller nowadays. Third one is loperamide. Loperamide will give in the condition of diarrhea. Diarrhea, and loperamide is contraindicated in infectious diarrhea. Contraindicated in infectious diarrhea. So, infectious diarrhea. This is loperamide. Next, fourth drug is codeine. Codeine is a antitussive drug. pertussive drug. It means most of the cough suppressants and all, in that they used to use codeine medication. Next, fifth one is pethidine. Pethidine. Pethidine we will give in the post-operative shivering management. Whoever undergone the surgery, after come back, they will get shivering because of that chillness, fluids, everything. Because of that condition, patient will get shivering. To subside that post-operative shivering, we used to give pethidine. Post-operative shivering. So this is the main drugs we will consider as a opioid drugs. First one is morphine, next heroin, loperamide, codeine, pethidine. So these and all comes under as a mainly in opioid classification. So for here they have mentioned morphine. So morphine, how we will remember the function of morphine and side effect of morphine and all, I will explain. One mnemonic is there, that is morphine BSC. What is morphine BSC? Morphine BSC. So these are the abbreviation for morphine. Mnemonic to remember the functions and effects of morphine. First we will see M means meiosis, means morphine will cause pupil dilatation. So meiosis means morphine causes pupil dilatation, and O means opioid group. Morphine comes under opioid group. Next, R means respiratory depression or distress. Respiratory depression or distress. So these are the main opioid, like morphine and all. Respiratory rate is very important in morphine. It P for decrease pain. H and I increase histamines. Because of increasing histamines causes rashes, itching. So these are the HI. N means nausea, vomiting. Next, E means euphoria. B means bradycardia. S stands for sedation. C stands for constipation. Cough, center, suppression. See, mnemonic of morphine. M means meiosis, means it will dilate the pupil, and O means opioid. It comes under as a group of opioid. R means respiratory depression. Respiratory rate will decrease, and P means decrease pain. This is a painkiller because their function is to reduce the pain of the patient. And next, HI means increase histamines. Histamine level in our body, it will increase. Because of that, we can see rashes, itching over body. Next, N means nausea and vomiting. This is common for all the drugs, most of the drugs. And E means euphoria. Euphoria means increase sweating levels and all. Next, B means bradycardia. Bradycardia means it will decrease the heart rate also. Heart rate decreases, respiratory rate also decreases. And S means sedation. Next, C means constipation and cough center depression it will cause. Next, contraindications. Contraindications. When actually we are not supposed to give morphine. morphine, then morphine side effect is meiosis. So it will dilate the pupil. So because of that reason we can't able to identify the condition of head injury. So that's why we are not supposed to give in the head injury condition. Second one is bronchial asthma. Bronchial asthma. In bronchial asthma, why we are not giving means? Like already morphine is suppressing, like respiratory depression causing. In that conditions, already patient having bronchial asthma means already depression is there, distress is there. In that conditions, if we are giving morphine, again we are making patient to more distressed respiratory system. So that's why we are not supposed to give in the bronchial asthma. And third one is any other respiratory disorders. Respiratory disorders. Any other respiratory disorders also we are not supposed to give morphine. And previously pancreatitis condition also we are not giving morphine. That is in a past guidelines. Now our new guidelines, they have changed. Pancreatitis is not contraindicated in morphine. So pancreatitis condition also we can give. Previously in pancreatitis condition, if we will give morphine, that sphincter they use, like morphine will constrict the sphincter. So all the juices in the pancreatitis, it will be remain in the pancreas. So because of that condition, we are not giving morphine in the previous guidelines. Now guidelines is changed. Pancreatitis is removed from the contraindications. If in the exam, now whatever exams are going on, in that exam, if unfortunately they have asked in which conditions morphine is not given, in that options all are common things and only one contraindication pancreatitis if they have given in the option. All remaining conditions are not there in the option, only pancreatitis is there, then you can go for pancreatitis. But if these are contraindications are already there, one of these is there, then we need to choose this one only, not pancreatitis, now changed. So these are the most of the important points regarding morphine. Now we will see, already patient got morphine in the intraoperative condition. Now patient reached to post-operative management. So first 24 hours, what nurse will observe? First option, assessing the client for tachycardia. Here patient, if patient taken morphine, then causing bradycardia. Here morphine is causing bradycardia, not tachycardia. So no need to observe for tachycardia. So option wrong. Next move on to option B, morphine respiratory rate hourly. Monitoring respiratory rate hourly. Somewhat okay. So we'll see remaining options also. See, administering naloxone every 3 to 4 hours. Here antidote for morphine is naloxone. Naloxone is an antidote for morphine. But here if patient got more morphine, like that conditions, antidote we will give naloxone. But here anyway they didn't mention the patient got need to get naloxone and all. So here option is wrong and no need to give every 3rd and 4th hourly, because antidote we will give when patient got a severe attack of medicine. Next option D, observing the client for signs of CNS excitement. Here also wrong. Why it is wrong means morphine function is to increase the CNS excitement. So already this is a normal function for morphine. No need to observe for morphine side effects. Next option B is a remaining. So answer here is option B. Here respiratory rate we need to monitor every hourly in the first 24 hours. Why? Because morphine is causing respiratory depression. So because of that reason we need to monitor respiratory rate surely in first 24 hours hourly, and continuation we need to check it as like a hospital guidelines. So here answer is B. Next move on to next question. So next here the parents of toddler who was recently diagnosed with severe retardation disease, their child future independent functioning, what should be the nurse conclude? Here what is the question means? First, whenever we are attempting any exam, any question, twice we need to check the question. Actually, examiner what they are asking the question. First, we need to understand the question. Then only we can move to options. Because first we will read the question hari-bari, and after that we will go into options and we'll think it like okay, this is maybe correct answer like that. But that is the main drawback to get a fail in the examination, because here not options is important. First question is very important. First we need to read 2-3 times question. We need to understand the language of examiner. Then only we can move to options. So here we need to first understand the question. Parents of a toddler. Toddler means 1 to 3 years of age group. 3 years of age group person have diagnosed with a severe retardation. Retardation means mental retardation, low IQ. Severe retardation, that child parents is asking to nurse like when our child will be do independent functioning in his life, like that they are asking. Then what should be nurse give the answer to that parents? So that is the question. First we'll see options. They accept the child's diagnosis. Option B, denial is being used in the defense. Option C, they want to explore the children limitations. Option D, intellectualization helps them put the diagnosis into perspective. So here, what is intellectualization? What is mental retardation? Also we'll see first. After that we'll choose the correct answer. First, IQ. Intellectualization. IQ formula is mental is upon chronological age into 100. This is the formula for calculating IQ level. So first we will see what is the normal IQ level. Normal IQ level is 90 to 109 is the normal IQ level for all human beings. Whoever is in a normal condition, they will consider as a 90 to 109 after calculating their IQ formula. They need to get in between, then we will see as a normal person. If having more than 110, then we will call as a intelligent. More than 140. If anyone have more than 140, then we will call it as a genius. Few people will born with a we'll see in the videos and all, no, like children's, like a 10 years boy has calculated 10th class questions, or 5-6 years boy also speaking spellings very randomly. That kind of we'll see, no. So they will consider as a genius if their IQ is more than 140. If intelligent is called when IQ level is more than 110. Normal when we will call 90 to 109 is a normal. If less than this, if it is have means, see, 70 to 89 if anybody have means, we will call as a poor IQ. If anyone have less than 70 means, then we will call them as a mentally retardation. Mental retarded person, like that we will call if a person IQ is less than 70. mental retardation also we have 4 categories. We will see first. Is mild, moderate, severe and profound. We have 4 options. Here mental retardation we will divide in a 4 stages, which is mild, moderate, severe and profound. So we'll see mild means IQ level will be 50 to 69. If anybody have 50 to 69 in between, they will consider as a mild mental retardation. For this kind of people, we need to educate. If we give education like everything, we need to educate. Then they can gain the information. Next, moderate. Moderate will consider as a 35 to 49. If in between 35 to 49, then we will consider as a moderate. For this kind of people, we need to give teaching. For every work, whatever daily routines or anything, we need to teach in every time. Next is severe. Severe, it means if patient having 21 to 20 to 34 IQ level, then we will consider as a severe condition. This kind of people are purely dependent. Dependent means along with that person, one more person has to be stay for a whole rest of his life to support that person, to give guidance or anything. It will be like a dependent. He can't do any work without that person, or he can't do any work himself. So that kind of person, dependent is important. Next, profound. If IQ level is less than 20, then we will call it as a profound. So these kind of people, custodial means under custody we need to see these kind of people. So these are the types of mental retardation in between. So now we will see patient having severe mental retardation. Severe mental retardation means he is under dependence, already depended on some others. So that kind of child, parents are asking when he can do independent functioning. These kind of severe person never do their independent things. Always he will be in the dependent. So, but parents are asking like that. Then what nurse has to be conclude means option A, they accept the children's diagnosis. They didn't accept it. They are re-questioning means they are not accepted the diagnosis. Next, option B, denial is being used in the defense. Mostly it can happen. So remaining options also we'll see. Option C, they want to explore their children limitations. No, not at all. They are not exploring. Option D, intellectualization helps them put the diagnosis into perception. No, here also they are not putting any intellectualization to understand the diagnosis. So option D also wrong. So here option B is the remaining. What? Denial is being used in the defense. Yes. Correct answer is B. Why? Denial means a plain, ordinary rejection. So here they are not accepting the child diagnosis. They are denying and they are re-questioning the nurse to when he can do their functioning. So here denial is used. So answer is option B. Move on to next question. So next question is, a client is receiving a albuterol to relieve severe asthma asthma. For which clinical indication should be the nurse monitor the client? Select all the templates. See, whenever we are in the examination, we need to focus some words in the examiner question. Like see, words are like severe, like except, important, most prior, and select all the template. And these kind of some few keywords is there in that questions that we need to focus. Some because not included. That is a question negative pattern. Most prior. That is a very important. Like that is in a question is in a positive mode. So these kind of words we need to see whether they are asking in the positive mode, whether they are asking in the negative mode. That is also very important to get towards a selection. So that is most important. So here they have asked select all the template. So here first we will see the question. Question what they are asking is, one client is there, one patient is there. That person they are taking albuterol drug to relieve severe asthma. Patient having asthma, to reduce that asthma, albuterol they are taking. So in that condition, what nurse monitor? So that is the question. In these options, how many is correct? That we need to put. So option A is a tremors, option B is a lethargy, option C palpitations, option B visual disturbance, option C decreased pulse rate. So here if we see option A, albuterol will causes tremors like shivering and all, it will cause. So answer option A also correct. Option B lethargy, no. Albuterol never causes lethargy, so lethargy is not correct answer. Option C palpitations, yes. Albuterol causes palpitations. What is palpitations means? Patient himself he can identify the heartbeat. Himself he can recognize that heartbeat. That is called palpitations. And option D visual disturbance. No, albuterol won't causes visual disturbance. So option D also wrong answer. Decreased pulse rate. See here itself examiner gave hints. What is the hints? Here see palpitations also given. Palpitations in that mostly heart rate will increase. So tachycardia, patient getting in a tachycardia. So in that conditions, how patient get decreased pulse rate? So here two options we can eliminate one of them. So here already increasing heart rate. Again same question option they have given decreased pulse rate. So it won't decrease pulse rate, it will increase palpitations means. So here answer is A and C. A and C is the correct answer for this question. Whenever you are attempting options, just apply elimination process. Through elimination process only you need to get an answer. Don't go flow like a randomly. This can be a correct answer like that. Don't do like that. Just apply elimination process. After ending you need to choose. First thing is you need to read all the options. Then only you can finalize, because if some questions will be there, in that questions same, if like any question they have given, in that 3 options also regarding that question only, but in that priority we need to choose. See, if we'll see first option, this is correct only, like that we can't put it as a first answer. We need to see all the remaining also. Maybe in that remaining also, maybe prior one will be there. That can be a correct answer. So in that conditions we need to see all the options. In that, after seeing all the options only we can put correct answer. So like the way only we need to deal with the question. So this is the correct answer for albuterol question A and C. Move on to next question. So next question is, a nurse concludes that a client is using displacement. Which behavior has the nurse identified? Here option A, ignoring unpleasant aspect of reality. Option B, resisting any demands made by others. Option C, using imaginative activity to escape reality. Option D, directing pent-up emotions to other than the primary sources. So here first we'll see the question. What actually examiner is asking? Nurse concludes. When nurse will conclude that a person is using displacement mechanism. This is a psychiatric condition, that is displacement is a mechanism. They are using some mechanism to that behavior. When nurse will identify that behavior when patient is saying something. If see, first is patient said something, on the basis of patient conversation, then nurse will decide he is using displacement mechanism. But what is the question actual patient used to make a nurse to decide that is a displacement behavior? So first is ignoring unpleasant aspect of reality. So this is not correct answer, because ignoring unpleasant aspect of reality means that is comes under undoing mechanism. So this is wrong option. Option B, resisting any demands made by others. No, this is resisting any demands made by others, that is a preservation. That is not a displacement. Option C, using imaginative activity to escape reality. This is also wrong option. Move on to option D, directing pent-up emotions to other than the primary sources. Yes, this is the displacement abbreviation, because what is displacement means, if see, for example, I will tell you, you are in the hospital. Your in charge or your seniors had a fight with you and they have scolded you too much. Badly they have scolded you. But there in that situation you can't give reply to them. So on that emotions you will come back to home, and in the home on your parents or your children's, anyone whoever weaker than you, that place you are relieving your emotions. Like in the primary sources you are in charge, but there you can't able to express your feelings, you can't leave your emotions. You will carry that emotion till your home, and weaker people you will leave your emotion. You will scold your children or your parents, I have done that, this and all, like that. So you are not giving correct answer in the same area. You are carrying that emotion and you are leaving your emotion in the lower area. So that is displacement. So you are displacing your emotion in the primary primary area to secondary area. So that is called direct pent-up emotions to other than the primary area. So you are not showing your emotions in the primary area where you are got scolded or got emotional. You will carry that emotion and you will replace in the some other weaker area. So that is called displacement. So here after saying this sentence only, nurse can conclude patient showing displacement behavior. So next question is, the nurse is preparing to administer 0.1 mg of digoxin intravenously, but digoxin comes in a concentration of 0.5 mg upon 2 ml. How many ml should nurse administer? See here the question is calculated question. Option A 1 ml, option B 0.5 ml, option C 0.4 ml, option D 0.8 ml. In each exam, at least one calculation is sure. In each exam, any exam, you take any exam, either Telangana or NORCET or JIPMER or RRB, any exam you will take, in that at least one calculation will be there. In some exams, more than like 4, 5, 6 questions also they will ask. So calculation is pakka question, so we need to learn easily. So here the calculation question is, nurse is going to administer digoxin. Actually need to 0.1 mg to patient, but digoxin is available in 0.5 mg 2 ml. 2 ml quantity lo 0.5 mg is available. So in that, how much ml if nurse will take means that can be a 0.1 mg. So here calculation question is, calculation formula is desired dose upon available dose into quantity. Desirable dose upon available dose into quantity is the calculative formula for drugs. So here desirable dose, how much they want? 0.1 mg they want. Upon available dose, how much? 0.5 mg. On hand 0.5 mg we have. In how much ml quantity, how much ml it is available? Quantity is 2 ml. So whenever we are taking values and all, that desired dose and available dose in the same measurement, like it is in mg. If it is in grams, lower also we need to take grams, or if it is in liters, or that time also we need to take liter area. So that measurement is should be in the same level for both desired and available doses. So here we have entered, then if we calculate, we will get 0.4 mg is the correct answer. Next, here we'll see option. Option A 1 ml, option B wrong answer, option B 0.5 ml wrong option, option D C 0.4 ml is the correct answer. So answer is 0.4 ml. So next question is, bandage shown in the photograph is used in the fracture of whatever bandage it was showing here. We need to identify what kind of bandage and where we have to use this kind of bandages. So option A humerus, option B scapula, option C clavicle, option D cervical spine. So this is a figure of 8. This whatever is showing in the photograph, that is a figure of 8. Figure of 8. So these kind of bandages we used to use in the clavicle bone, knees, all joints. These areas we used to use figure of 8 as a bandage technique. So here option A humerus wrong, option B scapula wrong, option D clavicle yes correct answer, option D cervical spine wrong. So clavicle bone, it is called as a beauty bone, and also we'll call it as a collar bone. In clavicle, this bone we used to call as a beauty bone and collar bone also, because it was available in this kind of area, so we will call it as a collar bone also. In this, one more question is like, if in the pregnancy baby is in a macrosomial means more than expected weight, baby is more than that weight. So that time macrosomial baby undergone normal delivery. Then what fracture we can expect means, in that situation clavicle fracture is a complication. So that time also clavicle it will involve. So I hope all you understood the question. Still, if you have any doubts regarding these topics, then do comment in the comment section. I will give reply, and what kind of topics you want to explain in the classes, that also you can do comment in the comment section. On the priority basis, how many members will ask the same topics and all, I will explain in the upcoming videos. I hope all you understood. Please don't forget to like, share and subscribe to our channel. Thank you so much for watching this video.